I'm Sharon Chang, and today on BizTech Health and Wellness Show, we have with us two doctors from Thomson Hospital, Kota, Damansara. Dr. Tan Wee Yong, consultant neurologist and physician, and Dr. Mohammad Redzuan, consultant radiologist and interventional neuroradiologist. They will be speaking on acute stroke and its latest treatments. Welcome to the show, gentlemen.
Hello, thank you for the kind introduction, Sharon.
Thank you, Sharon.
Most welcome. Okay, before we go into the causes and symptoms of acute stroke, Dr. Tan, can you share with us what is acute stroke and how prevalent is it in Malaysia?
Okay, I'll just briefly tell the audience first, because later I'll share with a case study for the audience to understand.
Yes, sure.
Acute stroke is actually a very common presentation in a hospital setting. So in a week, I will see almost every day there is an acute presentation. So, but in the general statistic, once you have passed 65 years old, there is a 1 in a 4-time lifetime risk that you have a stroke. So in summary, 25% of us will face a lifetime stroke in our life as we get older.
I see. Okay,
Prevalent.
so Dr. Tan, what causes actually acute stroke?
So I usually would like to divide this into two factors for the easier understanding of the audience. First is a modifiable factor and non-modifiable factors. So the non-modifiable factors including aging process, one. Second is because of people who have inherited metabolic disease, that they are prone to have like diabetes, they are prone to have hyperlipid, familial hypercholesterol. So the modifiable factors include hypertension, which can be controlled with medication, or diabetes that is induced by obesity. And the other one is most common is atrial fibrillation, that is abnormal heart rate that is beating in our heart. That is 5 most common causes that I can list.
So Dr. Tan, is it genetic or mainly due to environmental factors?
I would say both plays a part, but mostly I think 70 to 80% is environmental factor and dietary habits, and also comorbid. Comorbid means you have other disease coming together. Genetic factors, I do not doubt there is some factors, but they do not play a huge role.
I see. In layman terms, what is comorbid, that which you just mentioned earlier?
Comorbid means coexisting medical illness, which very commonly present in a lot of people now, including hypertension, diabetes, and hypercholesterolemia, so-called lifestyle diseases.
I see. Okay, Dr. Tan, I mean, recognizing acute symptoms, stroke symptoms, right, is actually very crucial as a rapid treatment. So to have a better chance of a complete recovery. So Dr. Tan, can you tell us what are the symptoms like?
So actually, we have been educating a lot of our patients. I think the campaign intensified in this 1 or 2 years via our initiative by Stroke Council Malaysia and with our partner with NASAM, the National Stroke Association. We have been educating public to recognize this. So I would actually list down the 4 most common factors that patient can come in. One is we use it as a mnemonic called FAST. F is face, facial paralysis, facial numbness. A is the arm numbness, arm, A. Okay, S is speech. Your talking becomes slurred or become unclear or become thickened, or you have a nasal speech. In overall, you feel yourself is not correct, the voice. That is S. So T is time. Time is to emphasize to the patient to come as soon as possible whenever they have these symptoms.
So normally, how long does the stroke symptoms last?
So it varies. So it usually happens very suddenly. That's why we call it a stroke. That means some of the patients say they are okay in the morning, but suddenly they cannot become weak. That is stroke. So stroke actually it comes suddenly, one, and the symptoms can become from the mild to become severe in, I think, progress very fast. It varies. It can become half an hour, it become very serious. Sometimes it lasts over days. Then it can become more organized, become more visible, I would say. So it varies. But as soon as you have the symptoms, I think any patient should come to the nearest healthcare facilities, regardless where you are.
So in your practice, Dr. Tan, how would you actually diagnose acute stroke from other general strokes?
So acute stroke, the word acute means that it happens at instant. So it happens within a period of time of within a day. We will say this is an acute. So stroke have these special features of weakness. So typically it's a weakness of one side. Not necessarily, it can be both sides. Typically it's a weakness of one side, like the FAST I have already shared. So typically facial weakness, arm weakness, or even leg weakness, and or the speech become blurred. And sometimes in very subtle cases, it's only numbness and feeling of the hand and leg actually does not belong to them. There's some of the people who describe. So acute stroke, I would say it happens very sudden and within a day. And let me just emphasize again, acute stroke is something that you cannot take lightly. Why? Because sometimes the symptom, it appear mild, but after the second day, it become worsen. And most of the time, if it keep up to the second day, a lot of damage cannot be reversed. That's why we want to hammer in the point that please seek treatment as fast as possible.
Okay, Dr. Redzuan, and also maybe Dr. Tan, can you share with us what are the treatment options available for mild to severe stroke diagnosis?
Okay, I think I'll speak first. Later, Dr. Rizal will speak or add on. So, acute stroke, the most crucial is still the timing. So, when you come early, everything I think it can be reversed. So, the available, I think the treatment, I think it has actually it has made I think life-changing procedure that is available now. We call it reperfusion therapy if the patient has come earlier. Like reperfusion therapy actually means that you try to unblock a clot that has blocked the brain. With this, we have medications without to put in the patient if the patient come in within the golden hour. Secondly, if the clot is at the artery, at the blood vessel that is accessible to endovascular surgery, I think Dr. Rizwan can perform a endovascular surgery or thrombectomy, we call it, to retrieve the clot and make the patient better. So I think this is Dr. Rizwan aspect, and I think Dr. Rizwan can answer on this. Dr. Rizwan, please.
Hi. Yes, as Dr. Tan have mentioned, so when a stroke patient arrive at our emergency department, they would have those kind of symptoms, weakness in the limbs and strange speech, we call it slurring speech, or combination of both. So based on this, if the involvement is more severe, the more severe is stroke. More organ or limbs are affected, the more severe is the stroke, and they will do a scoring system to objectively assess the severity of the strokes. And nowadays, Sharon, we have a very good and advanced machine, so which also will help us to diagnose, to prognosticate the stroke, and also to confirm sometimes the diagnosis. With the advance of technology, with the CT scan, we can do a special mapping of the brain oxygen. So based on that, we can diagnose stroke, and also we can tell the severity of the stroke, and we can see the blood vessel. So this is gold standard nowadays in any centers who are performing a stroke treatment. So there is an advanced procedure which is called thrombectomy. So basically, instantly remove the clot that cause blockage of the blood vessel that's supplying the brain tissue. So this is it started since 4 or 5 years ago, and it's transformed the landscape of the stroke care in Malaysia. Actually, before that, we have the drug, which is the clot busting drug, and after last 3 or 4 years, so we have the treatment called thrombectomy. So this thrombectomy actually can be used to treat a patient with a severe stroke, but timing is a critical. I would say that severe stroke, in a severe stroke, time is brain. So think of a severe stroke, we have to think like a fire in the forest. So it start to burn a few trees, and by the time, over the time, it's going to burn the whole forest. So this thrombectomy treatment is to put the fire out from the fire out and save the rest part of the forest or the brain tissue. So whatever has been damaged, we try to limit the volume of the damaged tissue, and we cannot bring it back. So as you can see in your slides there, that I'm showing, that's the clot which causing the blockage of the blood vessels inside the brain. And then next you can see the slide where there is some instruments that being put inside the brain and to pull out the clot. And the next slide is actually a clot from the real patient that managed to be took out. So next I will tell you about this procedure is actually done in an angio suite by a doctor, not surgery, not using a scalpel, basically through a tiny hole that is made at the groin of the patient. So through that tiny hole, we will put a small wire, small tube, like a plastic tube, very small, inside the blood vessel in the groin. And then we will push up with the X-ray guidance until we reach the site of the blockage. As you can see the images on your left, showing that there is no flow on that side of the brain. That side of the brain could be responsible for your movement, for your motor area. So after we put the special device, they're like a metal mesh which is used to engage the clot, and then we will pull out the clot, we restore back the flow to the oxygen, give back oxygen to the brain tissue, give back the nutrients, and try to make the patient to have a complete recovery back to the normal, or at least near normal, from before they had the stroke. So this procedure is a powerful procedure that changed the way we have the way that we treat the acute stroke.
Okay, Dr. Redzuan, so after the treatment, what is the percentage like from, for patients to maybe as a prevention to get another stroke? After this treatment, because it sounds very complex.
The procedure after with the procedure for the severe stroke, if you have, because the blood clot is long and big, so we need to quickly remove it by doing this mechanically, pulling out or aspirate the clot from the blood vessel. So by having this kind of treatment, you have a chances of 50% of recovery back to normal or near normal, compared to if you don't do the treatments, the recovery rate may be less than around 13%. 15%. So that's a very, very powerful effect of the treatment in a severe stroke, and it is basically we are talking about taking the right patient at the right time and to the right place, the hospital which can provide this clot retrieval treatment. And as you have asked me about the secondary preventions, I think Dr. Tan will explain more on the medication part, but as for the interventional, for the procedure part, because this clot that has blocked, it can come out from anywhere, from the heart, from the arteries in the neck, or arteries in the brain itself. And because of their coexisting diabetes or hypertension, they might have this atherosclerosis disease involving the arteries in the neck, which has predisposed the patient for the current stroke and also the future stroke. And this disease also can happen inside the vessel in the brain, and relatively this is common in the Asian population. And if this happen, we can do the treatment through the pinhole at the groin, again put a small pipe inside, and then we put a balloon there and to open up this, and then we put a stand there, leave the stand, and this will help the patient to prevent them, for another attack of the stroke. And normally this procedure is done within 1 to 2 weeks after the attack of the stroke. We need to do this quickly, but not too early, around 1 or 2 weeks, so that the patient had good chances to not have another stroke in future.
So Dr. Redzuan, is there anything that patients need to understand, or be aware during the treatment? Something that you can share briefly?
Basically, because this is done in an emergency situation, so they will see the doctors a bit rushing during the explanations, and because time is brain, as I mentioned to you, the more you will delay, the less chances for us to get a complete recovery. And then they need to understand that this procedure won't take too long. It's about 20 minutes, can be done as quick as 20 minutes. And there's no surgery involved, no scalpel involved, and it is a minimally pinhole puncture at the groin. And then this procedure is considered painless because we will do under a monitored sedation or general anesthesia. So they will be asleep, they won't feel the pain, and they should understand this is a safe procedure. It's proven by many studies, so they should not have a doubt to go through this treatment whenever they have a severe stroke, especially. And post-procedure, the doctors and the neurologist team, we have a team and we have an intensivist, we have a neurosurgeon in our hospital. The entire team will take care of the patient post-procedure. We will monitor the patient in a special unit, let's say stroke unit, or in an ICU, depending on the situation.
Okay, Dr. Tan, what would you advise? What kind of advice would you tell your patients so that they can recover quickly?
I think I fully agree with Dr. Redzuan, but I just want to add, this is not only you will recover, this is in fact life-saving.
Yes.
Life-saving.
Okay.
So if you do not have a massive stroke, you do not have a thrombolysis or thrombectomy, chances of you ending up dead is actually quite high, 30 to 40%. So in fact, it's a life-saving procedure and also recovering procedure. So about the advice for this patient, I think is you must recognize the symptom. That is the patient part. Okay. Recognize the symptom, come to the correct hospital at the appropriate time. That is the patient part. When they come to the correct hospital, then we will take care most of the thing and we will tailor the treatment accordingly to each patient requirement and each patient suitability. I think that's a very important point. Another one is, I think, since the start of this pandemic, me and the Stroke Council and the hospital has been actually actively encouraged. If you want to stay at home, you stay at home. But if there is really emergency, don't stay at home. So if there is really emergency, our hospital is open. So life-threatening emergency like stroke, you must come immediately.
Okay, doctors, as a final question, I will pose it to both of you. What can be done as a preventive measure against having another stroke?
So I think first of all, we will hunt very, very thoroughly to why this patient actually have a stroke. Only we can know the cause, then we can prevent. That is logical. So how to prevent? Yes, we find the cause first. So I would say 70 to 80% of Malaysian stroke is ischemic. Ischemic is a blockage. So usually why it blocks, the blood vessel become age, like Dr. Redzuan said earlier, atherosclerosis. So why it become age is because of diabetes, hypertension, and aging process. As aging process, we cannot reverse. We can reverse other factors that can modify. Appropriate medication, appropriate intervention treatment, like Dr. Redzuan have told about putting a stent. So I think that is the way to prevent. So with prevention, usually in place, we prevent another second or third stroke. So I think Dr. Redzuan will explain further.
Yeah, Dr. Redzuan, maybe you can share briefly with us.
As mentioned earlier, if you have a narrowed artery, a narrowed blood vessel in your neck, in your inside the brain, then this can be done without a surgery, just a minimally invasive. We put a stent, and this will help you to prevent another stroke. And I also would like to add, take the medication, the blood thinning medication, which will be prescribed by the neurologist, and listen to the doctor advice, and and then we need a good family support, also early physiotherapy. So be compliant and do physiotherapy, good family support for the physical and also mental support. Take a healthy diet. So all this will help faster recovery and also prevent a future stroke.
Okay, Dr. Tan and Dr. Redzuan, thank you very much for taking the time to be on our show. We have been speaking to Dr. Tan Yong, consultant neurologist and physician, and Dr. Muhammad Redzuan, consultant radiologist and interventional neuroradiologist, both from Thomson Hospital, Kota Damansara. This video will be on our Facebook and LinkedIn site, as well as on our website, www.biztech.asia. Please check out our website for business and technology conversations via articles, videos, and podcasts, and subscribe and like our Facebook and LinkedIn page. Thank you so much, doctors.